First of all, the intricacy of a healthcare facilities infrastructure indicates the necessity for facilities management initially in the hospital's construction, since the building needs to maintain its equipment on a regular basis to fulfill a proper standard of technology and safety requirements. Medical facilities around the world must not only react to disasters, but the ability to survive them by integrating environmental into the design consideration. Most vendors lack the necessary expertise and capabilities to properly execute facilities management services, particularly in vital and complex structures such as hospitals. Thus, crisis management planning process are a necessary skill that facility managers need to be equipped with to apply the knowledge gained to enhance the durability of the hospital systems.
Assalamualaikum, my name is Anizurina and I will present about the background overview of the building. So, the chosen building is Pantai Hospital Kuala Lumpur. Pantai Hospital Kuala Lumpur, PHKL, is a private medical centre that was established by the Parkway Pantai Ltd, which is a medical company based in Singapore, and it is the largest private healthcare provider in Southeast Asia. The hospital occupies a convenient location at Bangsa, Kuala Lumpur. When the PHKL was first created in 1974, it initially only had 68 beds and 20 medical professionals available. Moreover, there was initially a single building block of hospital. After more than 30 years, the hospital underwent a series of technological upgrades and imported more professional medical equipment. As a result, the hospital currently has a total 332 beds and more than 160 specialists working there. The loan structure constructed in 1974, which is currently considered to be the oldest portion of the hospital and is referred to as Block B, continues to operate as the building housing the emergency treatment area, ward room. After a number of years, Block C and D were constructed as the primary medical facility. The most recent structure to be constructed was Block A, which served as the reception area as well as the commercial and office building. This was only constructed in 2014. The hospital is now able to provide comprehensive medical healthcare facilities as well as the necessary equipment for diagnostic and therapeutic purposes.
Assalamualaikum, my name is Nur Aini binti Abu Tahib and I'm going to present for the Facilities Management Routine Services. The first one is hard services. These services are directly related to the physical part of the building and cannot be undertaken off-site. And then hard facilities management services include lighting, HVAC system, water system and fire safety. And the second one is soft services. Soft facilities management services are not required in contrast to hard services. Instead, software services improve the aesthetic and security of the workplace. Example of soft facilities management services including cleaning, waste management and security. Third services is tenant care. If tenants aren't satisfied, try to make them happy, give them a discount on their rent or watch them pack up and leave. And then, the fourth services is health, safety, security and environment, which is SSE. Providing a safe and secure and reliable environment of care, EOC, for patient is consistent with the mission of any healthcare facility. This refers to any hospital or medical facility where patients are treated, whether it be in an inpatient or outpatient setting. And then, the other services is financial. A facility manager needs to understand how to access and present financial data, how his budget affect the company finances, and how to use financial lingo and techniques. And for the facilities management additional services, the first one is consultant. Planning a building supports are included in consulting services for property-based facilities management. The consultation process starts with the definition of goals and requirements, continues through the tendering phase, and at this early stage, offers quality assurance during planning and implementation. And the second services is project management. Facilities management teams are highly involved throughout the construction process and in charge of making sure that projects stay on time and within budget. And then, post-COVID-19 operation is also the additional services. Designating COVID care areas where the establishment of designated areas for screening, triage, specimen collection and inpatient COVID care. And then, other additional services is sustainability. Delivery of all services including administrative, project management, operation and maintenance. And strategy consulting is based on the sustainability methods and practice completely integrated holistic approach.
Next part is the procurement. Procurement is the practice of acquiring product and services from a third party. Procurement entails several separate phases, method and procedure that must be followed if the business is to have a reliable foundation for service delivery. Based on the analyzed case study of Pantai Hospital Kuala Lumpur, the type of procurement utilized is public-private partnership PPP. PPP in its broadest meaning refers to any agreement between the public and private sectors to provide public services. PPP is a long-term contractual arrangement between public and private organizations in which the abilities, assets, and financial resources of the public and private sector are allocated in a complementary manner. The Malaysian government implemented PPP as an alternative procurement strategy that emphasizes increasing involvement of private sector supplier in providing public services under the 9 Malaysian Plan 2006. The asset will be created by the private sector and the service will be provided to the public sector client. In exchange, the private sector will be paid in accordance with the level, quality, and timeliness of service supply throughout the concession term. The organization's facilities management needs to be capable in establishing a framework for managing procurement through diverse stages. Compared to traditional procurement method, the process or stages of PPP projects required a completely methodical approach. Shown, basic step of PPP process based on the data gained from CIDA 2010. Next, service delivery. Facility management provides critical service support for the main operation of the firm. Any interruption or loss of service delivery could have an impact on operation and jeopardize business continuity. Service delivery consists into in-house and outsource. These two should both meet end users' objective while providing the best value. Outsourced service delivery involves hiring another organization to provide service on your behalf. And an issue in service delivery is that if key stakeholders need to consistently provide services to end users and must be handled and delivered properly, procurement must include them. Then, there are service specification and service level agreement SLAS, which are method for regulating service quality, performance, and value. They are the organization's criteria presents in such a way that service providers are incentivized to offer services that satisfy end users while also providing the best value. Regarding to Pantai Hospital Kuala Lumpur, they include both in-house and outsourced service delivery. The in-house service delivery includes all the facilities treatment to the patient, from physical treatment, drive-to treatment where they offer drive-to COVID-19 screening, and the e-health treatment which offer an online consultation towards the patient and for booking appointment. While the outsourced service delivery involves hiring another organization to provide services for the hospital, such as catering business to handle all the patient's food and the security for the hospital safety. The figure above show the example of service delivery that available in a healthcare building, including the in-house and outsourced service to end users, which is the patients.
Next is the facilities management contract. A contract is defined as agreement between two parties creating mutual obligations enforceable by law. In the construction industry, the client and the contractor are the two main parties to a contract. However, in facility management, contracts differs. The client and service provider are the parties in the contract. Any facility management contract must clearly define the scope of the services to be rendered by the service provider as well as the necessary key performance indicators or KPIs that must be satisfied. Hospitals have many operational requirements in terms of both physical facilities and administrative duties. Facilitating service providers is a common practice, but care should be given when thinking about putting an incentive strategy into place. Fortunately, service level agreements (SLAs) and contracts have flexibility built in to accommodate change, allowing incentive programs to be updated taking actual performance into account. Additionally, certain service contracts' long-term structure promotes a more tolerant attitude toward incentives and the performance adjustments that go along with them. In contrast, short-term contract may allow parties to maximize their earnings at the expense of one another. Regarding the case study that we analysed, Pantai Hospital Kuala Lumpur chose to outsource by employing Radicare M. Sdn Bhd, a firm recognised for its specialised competence in hospital facilities management. Professionals are engaged from outside the company where excellent service and customer satisfaction can both be readily provided. Both internal service level agreements and contracts with external service providers must comply with this criteria. In particular, if change is necessary and managed, principles and practices must be sufficient for the contractual arrangements under management and provide for considerable flexibilities. SLAs aid in defining the goals of the service provider Radicare M. Sdn Bhd and in guaranteeing that both client and provider expectations are met. The chosen agency's type of service, the performance standards that must be met, and payment terms are all stated in SLAs. KPIs can be used to assess and report service provider performance, allowing for the delivery of high-quality services.
Assalamualaikum, my name is Nadira binti Sulaiman. I will explain about the challenges in facilities and maintenance management. First, we have quality control and quality assurance. The issues in tracking of quality assurance and quality control. Although numerous studies have been conducted to assess the importance of quality assurance and control during construction, more effort is still required to enhance quality assurance and control throughout facilities operation and maintenance in field work was recognized as one of the problems of FMM in healthcare Malaysia. Second, we have inadequate specific PPP contract risk management model. One of the PPP concepts is to transfer risk to the private sector in order to maximize value for money. Market and revenue risk, design risk, construction risk, operational risk, financial risk, political risk, and environmental risk are all major hazards connected with PPP projects in Malaysia. Third, design influence on performance of PPP. A hospital design in particular must fulfill a variety of requirements that accordance to its utilities and facilities. Number 4, we have containing facilities maintenance management costs. Controlling facility maintenance expenditure is a significant source of worry for facilities and maintenance management. Even with limited resources and budget, maintenance personnel are responsible for keeping their facilities functioning smoothly and effectively. Last but not least, maintenance management strategies. When the maintenance budget is restricted, the choice of maintenance approach in hospital is substantially influenced. Prioritization of building components based on recorded data on failure incidents and fundamental causes is therefore the first step toward maintenance strategies and planning decision.
Now, I would like to talk about the additional FMM challenges during the COVID-19 outbreak. First one is profit reduction for facilities management provider. Facilities management and maintenance providers' profitability and cash flow are reduced as the client's postponement of service purchases due to the sudden increase of procurement and operational costs during COVID-19 outbreak. Most premises, depending on the orders of the government lockdown guidelines, will be reviewing the necessity for a partial or full closure of premises and a limitation of operations. Next is risk mitigation towards a safe work environment. Facilities management providers must assess cleaning routine, regular maintenance technique, area disinfection, and premise sanitization requirements to prevent the further outbreak of the virus to the occupants of building. World Health Organization suggests several for a safe workplace, such as desks and tables need to be wiped with disinfectant regularly and place antibacterial sanitizer devices in strategic locations across the office. And last but not least is demands to increase the air quality of building. Most facility management vendors are being requested to enhance the current cleaning and indoor environmental quality procedures to ensure the safety of building occupants. Air purifiers may enhance the quality of the air in a large space, perform several air exchange in 60 minutes, remove viruses, germs, and chemicals that are released in the room. And lastly, the HVAC system must be evaluated to see if it satisfies the criteria for clean air, since it is critical to ensuring the premises' smooth operation.
Next, we move to the recommendation of improvement in FMM. First, involve key stakeholders, establishing connection with key stakeholders and promoting buy-in to critical facilities project. FM can assist to minimize the building's environmental footprint, enhance recycling rates and garbage diversion, and guarantee overall operation function more smoothly. Second, keep facilities clean. Ensuring sanitary working condition is one of the increasingly important responsibilities of facilities manager. Third, customize your facilities management to meet the demand of your organization. Customized facility management workflows assist facility manager in capturing, tracking, and reporting on all critical details surrounding their facility process, provide the tool are needed for operational success. Number 4 is implement a preventive maintenance plan. FM need to aim for maximum efficiency for all the organization assets in order to save maintenance expenses. This will be able to extend the life of facilities equipment, reduce downtime, and reactive maintenance, keep an organized calendar for all project management tasks, track metrics, and maintenance schedule. Last but not least, use data trends to track and measure facilities management performance. It is one of our recommended best practice in facilities management is to gather and track as much information as possible. The list includes storing manufacturer, serial number, emergency repairs, and warranty information for all of the equipment and asset, as well as tracking workers' labor rates and hours.
In a nutshell, planning for the healthcare system and social well-being are crucial for the economic success and long-term growth of every nation. The purpose of facilities management is to guarantee that a building continues to run smoothly by upholding legal compliance and appropriate building management. Furthermore, recommendations to improve facilities and maintenance management are including involve key stakeholders in, maintain facilities cleanliness, adapt your facility management to the specific needs of your firm, implement a preventative maintenance plan, and track measure facility management performance using data trends. Moreover, additional FMM challenges during the COVID-19 exposure include profit reduction for facilities management providers, risk mitigation toward a safe work environment, and the need to improve building air quality. Client postponed service purchases due to a significant surge in procurement and operational costs during the COVID-19 epidemic, which reduces facilities management and maintenance companies' profitability and cash flow. That's all from us. Thank you.